will forget. Okay, there you go. Okay. So just spending a little time here reviewing what we spoke about in chapter 13. And I want you to take a minute and think about what we talked about as far as blood moving through our systemic circulation, our pulmonary circulation, and think about one word that you think summarizes the movement of blood through our system. So I'm going to give you about a minute or two. Think about a word, one word that you think summarizes how blood moves through our system based upon what we've talked about in the cardiovascular system. And you can just drop that word in the chat. And I'll give you about a minute to kind of think about that word and do that. So one word that kind of summarizes how blood moves through our system. And I'm going to start with the first word. Okay, I'm seeing some excellent suggestions here. So pressure, circuits, circulation, parallel, yep. Circulation, pressure, circulatory, yep. It's going to be a cyclical movement. Pressure, again, that's really important to drive that blood. Parallel, that describes the different circuits that we talked about. Circulation, right? Yep. Okay, so some good suggestions here. And this is pretty much kind of summarizing what we spoke about last semester. So let's go ahead and start with a poll question. Continuous is another good one. Yes, it's a closed continuous loop, if you will. All right, so let's go ahead and look at a poll question here. And this again should be kind of a review of how that blood moves through our vasculature. So let me launch this and I'll give you a minute here. Okay, last couple of seconds. All right, let's see. Okay, so the question, what is the order of vasculature from the left side of the heart to the right side of the heart? Most of you select the right answer, which is arteries, arterioles, capillaries, venules, and then veins, okay? So that's the order of vascular structures that are encountered when you go from the left ventricle back to the right atrium, okay? That's gonna be a really important relationship as we go forward, as you would imagine, all right? So this image is another image that I want us to think about when we look at that relationship, right? Blood is moving from the left atrium down to the left ventricle. It goes out to our systemic circulation via arteries, starting with the larger arteries, the smaller arteries, arterioles, then into the smaller branches, the smallest branches of the vasculature, which are the capillaries, then into the venules, and then into the larger veins, back to the right atrium, right ventricle, and then up to the pulmonary circulation. It gets reoxygenated at the lungs, and then it goes back into the left atrium. Remember, it goes out of the right ventricle via pulmonary arteries, and then it goes back into the left atrium via pulmonary veins, okay? So just kind of an overview of this system. We've got exchange of oxygen and nutrients happening at the lungs, and then we've also got exchange of oxygen and nutrients happening at the site of the capillary beds, okay? So as we kind of think about that in the back of our mind from chapter 13 and kind of move now to speak about blood flow, let's talk about some of the laws of physics that will govern how blood flows through our system. And when we think about these laws, they not only apply for blood moving in our vessels, but we can also apply these to any liquid moving in a conduit. And when I say conduit, I mean a hose or a pipe or any kind of conduit that allows for liquid flow. We can apply similar laws to the way that blood flows through our vasculature as well. Now, in order to kind of understand these laws, there kind of are two principles, and then we can put those two things together. So first of all, there's the pressure gradient. And the pressure gradient is the most important factor of the flow through the cardiovascular system. It's the driving force of blood through the cardiovascular system. And just to remind ourselves what a pressure gradient is, it's simply a high to low pressure movement. So this is also the force that moved blood through our heart chambers, if you remember that from last semester. Blood only moved from atria to ventricle because of the passivity, because of the gradient that was created, high pressure in the atria and lower pressure in the ventricle. And that same pressure gradient is what actually moves blood through our entire systemic and pulmonary circulation, our entire vasculature. We also need to think about resistance, and resistance is any kind of impedance to flow. So anything that's going to block that flow or resist that flow is what we think about as resistance. But we must take resistance into account in order to think about flow. Flow is the movement of the blood through the system, and anything that impedes that movement is going to obviously decrease our flow, and that's what we call resistance. And so we can relate pressure gradients and resistance as we talk about the systemic circulation, which is really putting those two pieces together and thinking about how those two factors, pressure gradient and resistance, influence our blood flow. Okay. So let's talk about what we know. What do we know? So we know that the circulatory system is a closed system. Anyone remember what that means? What does closed system mean? What does it mean that it's a closed system?
It means it has no access to the outside of the body.
Excellent. Yeah. So there's no access to the outside of the body, and there's no way to introduce anything into the vasculature unless there's a tear or an injury to a vessel, right? So for the most purpose, blood flow is going to be moving through our vasculature in a cyclical or circulatory fashion, the way that we kind of described. And some of you suggested it with those words as well earlier. And so we can also think about that blood flow in terms of an analogy. Think about blood flow through your vasculature in the same way that you would think about water flowing through a hose, okay? The force that's exerted by that water moving is really coming from the faucet, right? And if you think about the faucet, what would that be analogous to in our physiology? What's the faucet? What's creating the force?
The heart.
The heart, excellent, thank you. So the heart is going to be the main structure component that's creating that high pressure that is going to push the blood through our circulatory system. Likewise, if you think about the analogy of a faucet, we've got the hose, which is acting like our vasculature, and we've got the water, which is acting like our blood. So think about that analogy as we talk about these laws and how they would govern water moving in a hose, and then slowly apply that to how blood is going to move through our vessels as well. So the flow is going to be from high pressure to low pressure. And so the heart creates that high pressure at the proximal end, and then we've got lower pressure out in our distal end. So think about the distal vessels, think about the venous side of the vasculature where we've got lower pressures. And so automatically we have this high to low pressure, which is our gradient. That's going to be the driving force to move blood through our vasculature. Okay, really important concept. Now, we also want to think about the resistance, okay? And I talked about this before. What is going to impede that flow? That's going to be an important part of understanding the flow. And so resistance, we represent it with a large R, is going to be a part of this equation when we talk about flow. We can deduce that flow is equal to our delta P, which is essentially our driving force. And I don't want you to get confused about this delta P. This is simply high pressure to low pressure. What is the pressure difference? What is the pressure gradient? And then we have to divide that by the resistance. We must take the resistance into account because as we would imagine, that is going to impede flow. And so it's going to be a part of this equation. Okay, so flow is equal to delta P divided by any resistance or impedance that would be encountered. Alrighty. Any questions? Let me pause here and see what questions we've got so far. And if you do have questions, feel free to drop them in the chat as we go along, and I'll kind of monitor that as well. All right. So let's speak about the bulk flow. And bulk flow is really the net movement from one area to another. That's what bulk flow is. We can think about blood bulk flow in terms of a practical kind of example here, which we can see on the right, which is two containers. One has more liquid, one has slightly less liquid. And so the bulk flow is going to be the net accumulation of fluid from one side to the other. We can also think about bulk flow as our blood moving in our vasculature as well. All of our blood moving in one net direction is going to be considered bulk flow as well. And we mentioned this on the previous slide, the heart is what creates that pressure gradient. The heart with its high exertion, its strong force is what kind of gusts that blood out initially and goes and sends it through the arteries and arterioles. And then as we get to the venous side where the pressures are lower, that's where we have those, that's where we have that gradient being created. High pressure from the heart, low pressures in our venous structures. And so the heart is what really sets the stage for circulation and for the movement of blood through our system. We must have this gradient, okay? This gradient is what is driving the blood through our system. And if we think about not having a gradient, if we did not have a pressure gradient, if the heart was not pumping, the blood would just grind to a halt. It would not move through our vasculature and make its way back to the venous side, okay? So really important, we must have a pressure gradient in order to move blood through our system. Let's look at this schematic here on the right. So like I mentioned earlier, we've got two containers. We've got side A, side B. And because we have slightly more liquid in side A, we've got a higher hydrostatic pressure, which is about 100 millimeters of mercury. And then we've got a lower hydrostatic pressure on the on side B because we've got less fluid in that container. And so we can see that there's a pressure differential, i.e. a pressure gradient of about 40 millimeters of mercury, which represents the driving force of fluid from side A to side B. And so that's going to be what we talk about as bulk flow, that net movement of fluid because of that pressure differential from one side where we have high pressure to the other side where we have a lower pressure. And so the overall flow is going to be about 20 milliliters per minute. And remember, flow is going to be a rate, right? So it's going to be how much of that fluid is moving in time from one side to the other. Let's look at scenario B here. So what we see is that the amount of liquid in the containers is equal. So we don't have a pressure differential. So we don't have a pressure gradient. And so as you would imagine, there is no flow. Now, I want to point out there may be water moving from one side to the other and vice versa, but there will be no net accumulation of fluid on either side, okay? So the hydrostatic pressure, the pressure gradient is 0, therefore the flow is 0 as well. And then I want us to look at scenario C here, where we can see that although we have more fluid, much more fluid in this container, actually double the amount of fluid, 200 millimeters of mercury, pressure inside A, and then about 160 millimeters of mercury, pressure inside B. We still have the same rate of flow. Can anyone tell me why? Why do we have the same rate of flow as we did in scenario A? Although we have more liquid.
Is it because there's more resistance?
So there's not more resistance.
Because the driving force is the same.
Excellent, thank you. So the driving force is the exact same. The differential is the exact same. So the pressure gradient is 40 millimeters of mercury in scenario A, and then the pressure gradient in scenario B, C is also 40 millimeters of mercury. And so because that pressure gradient is the exact same, the flow, the rate is also going to be the same. And so the movement of fluid from side A to side B will be the exact same in scenario A and scenario C, okay? Let's see. So someone's asking, how do you know what the weight is for the flow equation? We're going to talk about flow and how we calculate that in a minute. But it is a weight, and I do want to point that out. So it's how much bulk movement of liquid we have, net movement that is, from one side to the other per unit time. We'll talk about that equation coming up in a bit. Okay. So let's think about our two circulatory systems. We've got the systemic circulation, we've got the pulmonary circulation. And so when we think about our pressure gradient, we can actually calculate this gradient. We can actually look at the pressure in our different vessels and look at the change in pressure from one structure to the other. In other words, the change of pressure from the arterial side to the venous side. And so if we look at our pressure gradient, we can take the pressure in our aorta and subtract that from whatever pressure we find in our vena cava, right? The aorta is the main arterial vessel, the vena cava is the main venous vessel. And so we should be able to observe our pressure gradient simply by looking at the pressure in these two structures. And so the pressure in the aorta, we can calculate that by looking at the mean arterial pressure. If you remember this, this value or this measurement from last semester, this was the systolic pressure divided by the diastolic pressure. So basically an average of the pressure that we see between across the entire cardiac cycle, both systole and diastole. And that's our mean arterial pressure. In other words, what does the average pressure in our largest artery look like? And then we can look at the pressure in the vena cava. That value is going to be the central venous pressure. So in other words, what is the pressure in our largest vein? Right before we get back to the heart, what does the pressure in that vessel look like? And if we subtract those two values, so mean arterial pressure minus central venous pressure, that is our pressure gradient. That is the driving force that facilitates blood moving from our largest artery, the aorta, back all the way through our systemic circulation and back to our largest vein, which is the vena cava. Okay. And then this schematic here, this graph actually kind of summarizes that nicely as well. So we've got this high pressure in our systemic circulation, starting with the arteries. These are the vessels that are closest to the heart. So we still have that high pressure coming from that gust of blood leaving the left ventricle. And then as we move throughout the more distal branches of our vasculature, so as we encounter arterioles, capillaries, venules, and eventually veins, we can see that there's a large drop off in that pressure. This is what that gradient is, right? That high to low pressure that allows blood to move through our system. Now, I want to point out here that we can observe there's less pressure in our pulmonary circulation. I'll talk about what that means and why we see that in a little bit. But basically, the pulmonary circulation still has a drop off. If it did not have a gradient, blood would not move through our pulmonary vessels, from pulmonary artery to pulmonary vein. So while we're thinking about the movement of blood through our systemic circulation from left atrium, from left ventricle into aorta, all the way back to the right side of the heart, and that's kind of the main system that we're going to be looking at, the systemic circulation, we want to remember that the pulmonary circulation also has blood moving through it, and so there also must be a pressure gradient to move that blood through our pulmonary circuit. Now, because it's a smaller circulation, or a smaller circulatory system, it's shorter in terms of the length that blood has to go. We're going to see less or smaller pressures here, but we will still see a drop off. We will still see a gradient.